Hi, my name is Anna Duran. I am a pediatric hospitalist and the Associate Chief Medical Officer for UNM Children's Hospital. Today we are talking about gun safety in the home where children live. UNM Children's Hospital has acquired 3,000 gun locks that we have distributed to all of our pediatric clinics, our pediatric emergency department, and we're working to get them into our behavioral health centers as well. It is actually a public health crisis. That is why we're talking about it. It's important to recognize that gun fatality or death by firearms has become the #1 killer for pediatric patients. That's children between the age of 0 to 24. Now in 2020, across the US, there were more than 10,000 children who were killed by firearm injury. American Academy of Pediatrics has really made this a statement. It is our role as pediatricians to inquire about firearms in any home where children live. Having a gun, there is a sense of responsibility with it, and making sure that it is safe, particularly from those who have the potential to harm or be killed by it. Gun locks, gun safe, gun boxes, this is our opportunity to be that responsible gun owner.
I'm Officer Jennifer Lucero with the UNM Police Department. So our typical gun lock is a cable gun lock, so we use that, just unlock it. We use the key to unlock it. From there, we're able to open our lock. Once we lock that back up, we have our keys. Our lock stays locked around our gun for safety. With our guns, this one is unloaded. This is a typical semi-automatic Glock. So with this, for our gun locks, we are going to be sure we're storing it with the magazine empty. We're going to lock our ejection port back. From here, the cable goes through the ejection port and through the magazine well. And from there, we are going to lock the gun, and typically that's how it's stored for safety reasons. So there's no way they can get the magazine in here or anything that could be harmful. So while we have the cable lock on, it prevents the magazine from being loaded. So a magazine would go here in the magazine well area as well. And also the slide is in that locked back position. So with that cable through those two areas, it prevents any ammo from entering the gun, and it is in that locked position with that lock on. And again, the keys are stored away from the lock, so they are not able to access the lock to take this off.
We do have statistics that show that homes that have children, about 1/3 of those homes have loaded weapons in them. Do not be surprised if your pediatrician inquires about whether or not you have a gun. They should also be asking how you are storing that gun, and it's important that we talk about how weapons are stored in your home. There's no judgment whether or not you have a weapon. It's really how do we keep weapons stored safely in a home, particularly those that have children or those who may be struggling with mental illness.
So these gun locks are important for safety reasons. There are several locations around campus that they can be picked up. The gun locks can be picked up from the police department as well as the UNM Hospital Pediatrics Emergency Department. The gun locks are available at these different areas for anybody that is interested in picking one up.
If you are interested in getting a gun lock for your weapons in your home or your relatives' home, families' homes, please ask for them. They are available for distribution.